So, hello, my name is Dr. Boris Stanzel. I'm with the Augenklinik Sulzbach in Germany. We conducted a study with the EyeMax mono lens in patients with atrophic AMD and some other AMD-like indications. And we looked at the readout also, in addition to visual acuity, also with microperimetry patterns. So the intriguing thing about the microperimetry was that our original working hypothesis was that because when you use a ordinary IOL, basically the optical path will be onto the macular scar, and so therefore having a lens that has sort of a wider angle viewing would benefit the patients in its ability to perhaps to get an PRL formation. And so then that's where microperimetry comes in, because you can really with so-called fixation cloud testing and the actual parameters for that is the BCEA variables that you can test. It turned out actually that patients who had a very large preoperative BCEA, particularly in the 63 percentile, then had a constriction of that BCEA to a smaller BCEA area, suggesting in fact that because of the wider angle capability of viewing of the visual field, this patient then thereby benefited by basically shrinking that fixation cloud and thereby perhaps also being able to fixate objects better. And that was reflected also with a two-line visual improvement, which is not surprising. This is it's often a phenomenon with normal IOLs that are monofocal, but the fact that the microperimetry data happened here is quite encouraging. One note of caution here is though that we don't have any control series that would really look at the actual statistically significant differences of a regular monofocal IOL towards this hyperaspheric design lens, but that's work in the future to be done. So from personal experience with this lens, this is a easy to go to solution. And in a sense, if once you get sort of a feel for this lens, you start seeing so many patients that could potentially benefit from it with a foveal atrophy of many different causes. And the surgery itself is just like any other cataract surgery. The implantation is the same, that the lens design is such just like a normal monofocal IOL. So the surgery is no different. But the interesting thing is, and this is something that I was really struck with from a patient that basically was sort of more higher educated, who told me instantly on day one is, wow, I have this perception of a wider visual field. And this is exactly, and we didn't tell him about this, but the patient reported it. And so that's really telling me that, wow, the design may be working. And so this is a very exciting technology. I think that at the moment doesn't really have a niche, so to speak, established. So I would really love to see this lens in much wider applications.